Firstly, welcome to our channel of the Shoulder and Knee Clinic, where we discuss about various issues pertaining to sports injuries, arthroscopy and shoulder issues. When you look at the rotator cuff, essentially it's a group of 4 muscles around the shoulder which allow for mobility and rotations of your shoulder. This is like the support team of your shoulder which moves it in various directions. Now, how can the rotator cuff tear get injured? Essentially, when you had a fall, you're not able to lift your hand, that is one of the symptoms of a rotator cuff injury. Additionally, with repetitive overuse, with age-related degeneration, people can have rotator cuff tears. These are called degenerative rotator cuff tears. What are the symptoms? Essentially, you will get pain on the affected side. Sometimes people will experience difficulty in sleeping on the affected side, weakness when you're trying to lift your hand up. These are the most common symptoms of a rotator cuff disease. So somebody who is getting popping or clicking sensation in the shoulder, having pain that disturbs the sleep, that's how mostly people present to us. What are the treatment options? Well, treatment options essentially depend on how severe the issue is. So essentially, to diagnose this problem, ultrasound or an MRI can be done. X-rays are generally not beneficial for identifying rotator cuff disease. On a MRI, essentially we assess the significance of the tear, whether it's a partial tear or a full thickness tear, whether there are any associated issues in the shoulder. Now, when you look at the treatment for this, essentially in partial tears, physiotherapy, activity modification to allow healing, physiotherapy essentially to improve the strength of the other muscles in the shoulder, icing, NSAIDs, everything can be done initially, and that's the mainstay of treatment. If despite a non-surgical treatment, individuals do not improve over a period of 6 weeks to 3 months, then surgical treatment can be considered. In full thickness tears, although a surgical treatment is advisable, because long-standing full thickness tears can retract over a period of time, as your rotator cuff is an elastic thing, it's like a rubber band. So once the tear is complete, it can start retracting, and additionally the muscle can get infiltrated with fat. So in partial tears which are not responding to non-surgical treatment and full thickness tears, keyhole surgery or an arthroscopy is done. Essentially, the surgery is done through small cuts around 5 millimeters around your shoulder. We put the instruments and the arthroscope inside the joint. We visualize the tear and repair the rotator cuff. Post-surgery rehabilitation protocol is there, and there are various exercises which need to be done to recover from the surgery, and we guide you during the process of rehabilitation. Since it's an arthroscopy, typically it can be done as a day care or a one-day stay. Rotator cuff surgery gives good results and restoration of full strength and function in your hand. So the moot point being that rotator cuff disease is fully treatable, whether through a non-surgical or a surgical treatment, depending on the severity of the disease, and don't hesitate in reaching out to a shoulder specialist near you to treat this problem. If you like this video, do share, like and subscribe, and definitely do show it to somebody who is having a shoulder pain which is not improving despite treatment. Thank you. Stay tuned.